Hey guys, thanks for joining me for another episode of my YouTube channel. We're finally going to wrap up this section on recommendations for prevention of cognitive decline and dementia with really a summary. So this is the money slide here. But before I dig into it, I just want to remind you to subscribe to the YouTube channel, share this with friends, family members. Thanksgiving's coming up, so a lot of people are going to be with their loved ones. Talk about this. A big issue that we're facing is that awareness is lousy when it comes to what is dementia, how do we prevent it, what causes dementia. There's just a general lack of awareness. So I hope that you'll kind of use the upcoming holiday time to talk to your family members about it and spread the word. Alright, so this is a table taken from a publication that I, along with Dr. Neil Graff Radford, had a little bit earlier this year. And the first panel, as you'll recall, we talked about diet and supplementation. So the Mediterranean diet, and even more so the MIND diet, has evidence behind it that this is effective at slowing cognitive decline. Regarding all of the vitamins, if you're deficient in them, absolutely, you want to bulk those levels up. But if you're not deficient, if your levels are normal, there's not compelling evidence that additional supplementation will have any effect on cognition. In fact, high levels of some of the vitamins can actually be detrimental to cognition. So save your money and buy someone a better gift this holiday season. Next is exercise. Now, I like to think about exercise in really three components. So one, the obvious, is physical exercise. So the recommendations are regular aerobic exercise. That's getting your heart rate up into that working heart rate range. And based on your age, you can find out what your working heart rate is online. Just Google it. And then the second part of exercise is cognitive exercise, so cognitive training. Learn new skills, participate in cognitively challenging exercises like crossword puzzles or Sudoku. When you go to the gym, if your arms are weak, you focus on the arms. It should be the same thing with your cognitive exercises. If you're a numbers person, try a crossword puzzle. If you're a word person, try a Sudoku. Work on those weak areas. And then what I like to refer to as kind of the third tier of exercise is social exercise. You know, it takes a lot of effort to be able to carry on a conversation with one person and even more in a group of people. You've got to listen to what the people are saying. You have to pick up not only on the words, but on the body language, on the prosody or the intonation, the changes in intonation of their speech, and then be able to respond in some kind of meaningful way. That's a lot of work for your brain to do. So consider social activity as a form of exercise. So physical, cognitive, and social exercise. And the next part is reducing your cerebrovascular risk factors. So these, skipping down a couple of points, these are things like blood pressure, cholesterol, diabetes. So that underscores the importance of having a primary care physician that can check these things regularly to make sure that you're falling within the guidelines. And then kind of going backwards, I apologize. You want to practice good sleep hygiene. Make sure that you're going for, a solid 6 to 8 hours of sleep every night. And then I think it goes without saying, but you should avoid use of tobacco products. The reason that you haven't heard about any of the good effects of tobacco is because there aren't any. So if you haven't started, don't start. If you have, also speak to your primary care physician about ways that you can stop. There are lots of medications out on the market to help people overcome this tough habit. And I'll also say that it usually takes most people multiple attempts to stop smoking. So if you've tried and were unsuccessful, don't be discouraged. Just get back on the horse and try again. It's also very important to tell people that you're stopping. Those individuals that have a support group that can help hold them accountable are far more successful at stopping smoking. So good luck if that's something you're about to try. Also, if that is something that you're considering trying, comment to some of these videos. There are lots of people out there that are going through what you're going through or are considering going what you're going through, so the more support, the better. And then it's also very important to maintain an appropriate body mass index. You don't want to be too low, you don't want to be too high. That goes along with the diets that I mentioned earlier. So if you're eating an appropriate diet, and if you're getting your exercise, then you're doing what you need to do. But if weight continues to be an issue, I would suggest discussing that with your primary care physician, because there may be some other alternatives to assist in weight reduction. And as I discussed in the last video, it's important to treat sleep apnea. That's evidenced by increasing volumes in brain regions such as the hippocampus and improvements on cognitive testing in those individuals that have received treatment. Also, practice good oral hygiene. Make sure that you're brushing your teeth daily, you're flossing, and you're seeing your dentist regularly. Also remember that reduction in hearing is associated with cognitive decline and dementia, so I can't stress enough how important it is to protect your ears. If you've got children, also make sure that you're protecting their ears. It's easy enough to bring around those little earplugs that can fit inside your ears if you know you're going to be in a particularly noisy environment. The short-term inconvenience of doing that, I think, is going to yield long-term dividends that are certainly worth it. Also, avoid the use of anticholinergic medications. There are tons of these medications, and so I suggest Googling them if you have any concern about a medication that you're taking. There may be compelling reasons to be on an anticholinergic, but if there's any question, I would suggest discussing the specific medication with your primary care physician and recognizing that there is a risk associated with these meds for development of cognitive decline and or dementia. Also, alcohol use. Yes, alcohol is contained in the Mediterranean and Mayan diets, but that is in moderation. And as I mentioned in earlier videos, moderate alcohol use is associated with a steeper degree of cognitive decline. And then lastly, make sure that depression and anxiety are being treated properly. These mood disorders are increasingly prevalent in our population and can impact cognitive function. In fact, as I've mentioned previously, untreated depression sometimes can look like dementia, and we even call it pseudo-dementia. So the treatment for dementia and depression are very different, which underscores the importance of knowing which one you're dealing with. So I hope that this talk has been beneficial in giving you kind of a roadmap of the risk factors that we know in the end of 2018 regarding cognitive decline and dementia, and also some not so difficult strategies to employ, some lifestyle modifications, managing risk factors to help reduce that risk of cognitive decline. I think the good news is that there is hope. There are things that we can do that aren't all that difficult to decrease our risk of cognitive decline and development of dementia. So don't forget to subscribe to the YouTube channel, hit the notifications button, send some questions, some comments, and happy Thanksgiving.